For people who have wounds that won't heal, life can be less enjoyable because of the pain, the infection, and the loss of mobility that goes with those wounds. However, there is effective treatment for those wounds at the Salina Regional's Wound Care Clinic. I'm Dr. Dwayne Beckenhauer, Medical Director at Salina Regional Health Center's Wound Care Clinic.
Let's start out and talk about why wounds don't heal and what type of patients you see.
The most common patients that we see are folks who have diabetes or some other underlying medical condition that affects their wound healing. Majority of the reason why wounds don't heal that we see is either diabetes or smoking. The factors that influence that is like pressure, so walking on an open wound, laying on one like a pressure sore, lack of oxygen that you would see with arterial disease or with smoking.
Let's look at some of the treatment options you do.
Our primary modality is debridement, or removing dead tissue and the bioburden or layer that builds up that prevents wound healing. We also use a ultrasound machine that helps to remove that same film and also kind of kills the bacteria in the wound as well. We have multiple dressings, including items that help to heal, absorb fluids, retain fluids depending upon the nature of the wound, and we have several skin substitute grafts that augment healing as well.
When should someone become concerned that they have a wound that's not healing, and when should they seek out help from a specialist such as yourself?
I think people who have diabetes or chronic conditions, like they have cancer, they're under chemotherapy, immunocompromised people who are taking one of the immunodrugs for chronic conditions, probably should see their regular physician relatively soon if they suffer any type of injury. We are a referral center, so you have to see a primary physician or the emergency room initially, and I think a good guideline to seek care with us is any wound that has been there for like 4 to 6 weeks and hasn't shown any progression. Any wound that is painful or looks infected is something that should be seen probably a little bit sooner.
Let's talk about the team you have up at the Wound Care Clinic.
Currently we have 4 general surgeons, we have 2 podiatrists who provide care, and we have 1 advanced practice nurse as well. We have a really dedicated and excellent nursing staff. It consists of 11 RNs and a couple of support personnel.
Thank you so much for some great information, and thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.